Is it possible to make hospital food that is environmentally sustainable whilst maintaining or even improving its nutritional quality and appeal to children, and doing all of that in budget? Well, that's what the team behind the menu here at the Birmingham Children's Hospital are aiming to do, in collaboration with the Mandala Consortium. I'm here today to learn how these menu changes are being designed and implemented, what the challenges are of balancing environmental sustainability with nutritional quality, patient satisfaction and cost, and what the broader implications of this work might be for food reform across the public sector as a whole. So how are the Mandala researchers, such as yourself, working with the team here at the hospital? And what is it that you're measuring to evaluate this project?
Mandala takes what we call a co-design approach. So that means we work with the stakeholders in the system to actually think about what needs to be done and how it can be done. So they've helped us to map the system, to understand what could be done, to think about what different interventions they could do. And then we've worked together to kind of support them to design their menu changes, but also knowledge exchange with people from schools and early years who've done this kind of thing, so that they can really get some lessons to think about how to do it well and learn from past experiences. What we're evaluating is the impact of the changes, so the reformulations they've made to their menus on the environmental footprint of the food that's been ordered, and we measure that against how many people have eaten it, how many of the patients have ordered it.
Why is institutional catering, like hospital meals, really important to food system change?
Public sector food procurement, so the food served in institutions like schools, hospitals, prisons, has been identified as a really important lever, an important way for changing food systems, because it can change potentially the whole systems. It can change our preferences for what we eat later, but it also influences the ingredients that are bought, so it influences the supply chain for those ingredients. So if we put in place standards to make the food nutritious and sustainable and fair, we can influence the system by those standards being in place, but also other private sector institutions taking on those standards and those becoming kind of standard things.
What are some of the constraints that are unique to working at a children's hospital?
There's been quite a bit of research and activity generally around improving children's food to make it more healthy and sustainable, but that's tended to be in schools and early years, whereas here in the hospital we have some very particular considerations that we have to focus very heavily on: the nutrition and the appeal, obviously, because we're talking about children in hospital, but also the average stay of the children is only 3 days. So with schools and early years, they spend a lot of time on familiarisation and education about why they're changing the food and getting children used to it, whereas here they don't have that luxury.
So Tom, what motivated you and the Sodexo team to support the menu change interventions here at the hospital?
We wanted to do something that was beneficial for the environment, and we're already working on making our menus more sustainable. We've also been supporting the Trust with their NHS Green Plan, and to be part of something that could be scaled up was really exciting.
And how have you gone about designing and implementing the menu changes?
So Mandala supported us with holding a workshop where we understood what other sectors were doing, so most notably the school sector. We then went back and held meetings internally to understand what was possible, and we decided on incremental changes to the menu, and we're going to carry those out every quarter.
So Phil, as Associate Director for Facilities here at the hospital, you're involved in the work around innovation and sustainability. What role does food play in that work?
So we know that food accounts for less than 1% of the Trust's total carbon footprint, but nevertheless, like the whole NHS, we want to get our footprint down to zero. So we're using this project to try to tackle that.
And what measurable impacts are you hoping to see?
Well, we're hoping to see, obviously, the reduction in carbon and improved environmental benefit. We're also hoping to see an improvement in patient satisfaction. Trying to get the two together is a real challenge, and that's why we're hoping this project can succeed in.
And so how is the Mandala project supporting this work, and what are you hoping to come from the collaboration?
I think, first and foremost, it brings a whole load of credibility through academic rigour, which we just wouldn't have without the Mandala Consortium behind us.
Charlotte, as lead dietitian on this menu, how have you balanced food that is environmentally sustainable and nutritious with food that children want to eat?
Yeah, absolutely. So we've taken a kind of incremental approach to changing the menu. So we haven't taken off the familiar foods that children are used to and the meals that they enjoy, but we've reduce the animal protein in the meals and increase the plant protein. So essentially what that's done is kept those familiar meals going and exactly the same as they were before.
And what's the most surprising or rewarding thing you found so far from the process?
I think the most surprising thing is that they haven't really noticed any of the changes that we've made, and that's come out of taste testing sessions that we've done with young people, that they can't really tell the difference between the meals before and after. I think that's also been the most rewarding aspect of the project, that we can see that you can make meals more sustainable without having a negative impact on patient experience.
So Asma, we had a look around the kitchen earlier and saw some of your delicious looking meals. They look fantastic. What feedback have you been getting on the food here?
Our strong feedback for Mandala project is we are not receiving any negative feedback.
That's good feedback.
So, yeah, I noticed recently we are giving more and more macaroni cheese, chicken tikka, shepherd pie.
When it comes to food system change, there is no silver bullet. It requires collaborative work across the entirety of the system, and that is exemplified really well here at the hospital. Even though food is a small part of their carbon footprint, it's still a necessary area to look at on their road to carbon zero. And it's exciting to see how these small incremental changes that they're making here can be scaled across the hospital itself, across the city of Birmingham, and maybe even further across the UK and beyond.